Welcome to this presentation titled Safe and Optimal Weight Loss with Semaglutide. My name is Cheri Stoka, and I'm owner and founder of Weighless MD, and I am excited to bring this presentation to you and help you better understand how we work with our patients who are on semaglutide. So go ahead and get started and talk about what is semaglutide, otherwise known as Wegovy. That is what we use at Weighless MD. This is an FDA-approved medication for chronic weight management and type 2 diabetes. This is a weekly subcutaneous injection. So basically what it is a synthetic hormone that mimics GLP, which stands for a glucagon-like peptide. So it mimics this and affects certain areas of the brain that control appetite and fullness. It also affects the pancreas by improving insulin sensitivity. It slows gastric emptying and also reduces food intake by, again, affecting certain centers in the brain that control satiety. So I'm going to get into a lot more detail, but I wanted to just lay the foundation on really, what the medication is. So these are the two FDA-approved conditions. So again, I'm going to talk about how Weighless MD uses the medication off-label, which is very common. Most medications on the market are used off-label, but this is the FDA-approved conditions. So type 2 diabetes and weight management or chronic weight management. So for the weight management part, the stipulations are that one would have a BMI of greater than or equal to 30, or they would have a BMI greater than or equal to 27 with a comorbidity, which would be something like hypertension, dyslipidemia, something along those lines. The Weighless MD approved conditions are the following. So we will work with anyone really who is looking to lose weight, anyone who obviously does not have any contraindications or precautions to the medication, anyone who wants to improve their metabolic health, anyone who wants to control their appetite and cravings, anyone who has yo-yo dieted their entire life and they're just at a point where they have weight loss resistance and they need help. And of course, anyone who has insulin sensitivity and or imbalanced blood sugar regulation, which I know many people don't really know. I am going to talk a little bit more about this because this piece is very important as it relates to your metabolic health. So just to better understand what type 2 diabetes is, I wanted to just go through some of the basics because I do feel like the majority of people that either are type 2 diabetic or they are getting really close to getting that diagnosis, they really don't fully understand what that really means. But essentially, type 2 diabetes is a chronic metabolic condition. Well, I'm going to take a step back. It can be acute because type 2 diabetes is reversible, but it is a metabolic condition that causes sugar to build up in your blood. This is due to insulin resistance. Insulin, basically, its main role is to take the sugar out of the blood and transport it into the cells so the cells can actually use it for energy. But when insulin does not work properly, the sugar doesn't leave the bloodstream and it stays in the blood, and that's what causes all of the other issues that begin to happen. So the body no longer metabolizes sugar and the body no longer accesses calories as it should. So hence metabolic dysfunction. When sugar cannot get into the cells to be used for energy, the body will actually do what it can to get it out as soon as possible because it is so damaging in the bloodstream. So what will happen is it will be converted to fats or triglycerides, and it will be then transported and stored in the visceral fat, the visceral of the body. When it is transported into the visceral area, this fat becomes very inflammatory and very toxic. So this is when, again, the whole cascade of events begin to happen that cause more harm to the body. And now this fat becomes very difficult to access. It's really important to understand that metabolic dysfunction starts years before you start to see blood sugars creeping up, or you are told that you're on the cusp of developing type 2 diabetes. You know, there are so many signs that our body tells us on a regular basis that things are not working properly, but we as, you know, as a nation are so used to just waiting for that diagnosis and being put on medication. So again, it's really important to understand that these things start to begin to manifest very, very, very early on. Metabolic dysfunction, it could mean anything from blood sugar dysregulation, hyperlipidemia, hypertension, hyperglycemia, which again is just high blood sugars, or of course high waist circumference, which would be the high visceral fat. Glycemic variability means blood sugar dysregulation. It really just means that over time, your blood sugars are spiking and lowering all day long. You don't really know it because most people aren't managing or checking their blood sugars. And so it's kind of like this silent killer over the years because it's not something that's managed. So you see this graph and you can see the shaded green. And this is a blood sugar range of 60 to 120. And so throughout the day, you really want to stay between, you know, 60 would be maybe a waking or in the middle of the night, but you want to stay probably between 80 and 120, 130. When you start going up to the 200s, 220, that is showing that you have metabolic condition that is happening because the continuous spiking of the blood sugars is causing disruption in so many different ways in the body. So again, the more we can manage our blood sugars throughout the day, the more we can understand how to control our blood sugars, because it's not just about the food. It can be about your sleep, your stress. It could be about food sensitivity, certain foods that you consume that is a stress on the body. You know, there are many things that contribute to blood sugar dysregulation. And again, it's bringing this awareness to people, you know, so they understand that this is something that really can impact their health. So again, glycemic variability, or this blood sugar dysregulation over time, causes insulin resistance or insulin sensitivity. It begins this systemic inflammatory response in the body. It also begins to cause the dysregulation of hormones. And again, the fat stores in the visceral area become very inflammatory. So you can see here, most people hear about like the belly fat or the visceral fat. That is the fat that surrounds the vital organs. When you have fat that is intertwined and surrounds all of these vital organs, the organs do not function as they should. So that's why you get systemic inflammation, you get an increase in insulin resistance, you get signaling of hunger and stress hormones. Again, it is often the root of so many different things that are going on in the body. And it really should not be confused with subcutaneous fat, because subcutaneous fat is that pinchable fat. It tends to be more non-inflammatory, whereas the visceral, you cannot pinch that because it's deep within the abdominal cavity. Chronic inflammation is basically the beginning of every chronic disease. And if you have a high visceral fat, you likely have inflammation. So that really means that there is some sort of chronic condition that is brewing in your body. And that manifests in many different ways. It just depends on what your vulnerabilities are. You know, maybe you have a genetic propensity to develop Alzheimer's or arthritis or ulcerative colitis. So it really depends on your genetics and your, you know, other things going on, but inflammation does start the progression of disease. When sugar stays in your blood for long periods of time, your blood becomes thick. It becomes syrupy. So as you can imagine, if you have syrupy blood, that is going to be a problem. Sugar becomes very toxic to the blood vessels, so it begins to break things down. It can start to cause clotting in certain arteries and vessels. Blood flow cannot get to certain areas of the body where it carries nutrients, so the different areas of the body stay healthy. So when you think about diabetes, which obviously is a blood sugar disease, you hear that people develop neuropathy in their hands and their toes, and some people have to have limbs removed because there's no longer blood flow or nutrients getting to that area. And that is simply because the blood thick and viscous, it can't get to those small little vessels, and the vessels lose oxygen and nutrients and they eventually die. So how does semaglutide work? Semaglutide is going to improve insulin sensitivity. Remember, insulin, its main role is to pull sugar out of the blood, move it into the cell, so the body actually uses that for energy. When you are eating a well-balanced diet, this effect of semaglutide is much greater. Things begin to work a lot more efficiently. And the reason I point that out is because there are a lot of people who are ordering semaglutide online. They're just going to pick up semaglutide, but they are not being advised outside of just injecting the medication. There's so many different components that need to be managed when you're on this medication. If you continue to eat poorly, it's going to be difficult to normalize insulin and blood sugars. So therefore the effects you're not going to see the weight loss effects as much. Appetite suppression and fullness due to the medication really helps with diet adherence. And as you begin to heal and start to regulate these blood sugars, you are going to start to see so many different things in your body begin to improve, because again, we're getting to the root of many different things. And that is the whole goal of getting the body into a healthier state, is not chasing everything. It's let's get to the core and watch everything else start to respond. When you start to control your blood sugars more effectively, you're going to notice more sustainable energy. You're going to notice that you can actually now burn fat. Because when you have elevated blood sugars, your body is unable to access the fat stores because it's just going to keep burning, you know, the sugars that are available. You are going to see a reduction in inflammation when those blood sugars are managed. When you see a reduction in inflammation, you're going to see a reduction in cholesterol levels. Believe it or not, high cholesterol is due to sugar. It's not due to, you know, fat. It's not due to cholesterol in your diet. It is due to sugar. Lipids begin to normalize. And like I said, it is truly amazing how the body begins to respond when you really give it what it needs to perform. It has been shown in a recent study that approximately 90% of Americans have some type of metabolic dysfunction. The majority of people don't know it. But if semaglutide is great for metabolic dysfunction, shouldn't everyone be on semaglutide? That is the question. So not everyone is a good fit for semaglutide. And I'm going to kind of go through some of those things, but some absolute contraindications would be the following: thyroid nodules that have not been checked for cancer, a prior allergic reaction to a glucagon-like peptide, because there's numerous on the market, a condition called medullary thyroid carcinoma, or a condition called multiple endocrine neoplasia syndrome. So those are the two big ones. And then pancreatitis is an absolute contraindication as well. Some precautions that you would be mindful of, these are things that we are definitely assessing prior to starting anybody. But if there's a history of recurring gallbladder issues, if there's history of significant gut issues such as constipation, reflux, diarrhea, IBD, IBS, etc., a history of anorexia or binge eating. If you are someone who had recent surgery or have upcoming surgery, we're definitely going to hold off prior to that or post-surgery. And of course, anyone who decides to get pregnant, we are definitely going to stop we're going to stop the medication at least 3 months prior to conceiving. So how are we different? So we are a weight loss and wellness clinic. It is all we do. So we live and breathe this stuff. So we're very strategic and focused with all of our programs. But essentially, what we're going to do is we're going to provide a comprehensive body composition analysis at the beginning, at the end, and all throughout the program. We're going to provide specific meal plans. We will have you come in for bi-weekly counseling sessions. You will receive a bi-weekly assessment prior to your visit so that we're able to, plan for those visits. Do we need to adjust the medication? Do we need to incorporate other supplements? Do we need to make modifications to the diet? We need to manage your symptoms a little bit better, etc. So we're looking at all different aspects as you go through the program. This is just an example of the assessment that you will receive when you're working with us. Again, we just want to get a gauge on all the different systems in the body. What imbalances? Are you having issues with sleep and fatigue? Since digestive issues are very common, well, I shouldn't say common, but they are the most common side effect on semaglutide. So we're assessing all of the digestive issues. We are also focusing a lot on muscle mass, because when patients go through this program and they are taking the medication obviously helps reduce appetite. So we want to make sure that patients are still getting enough protein, because if you start to lose muscle, that's actually putting you in a worse metabolic state. So we not only are measuring muscle, but we also want patients to be very engaged and understand their health as they go through it. If we're noticing on their body composition that they're losing muscle, we are definitely having a conversation with them about that. We talk about the diet a lot. We are asking questions about the diet, but patients are also logging their food in their app. We set all of our patients up on our app when they start the program. Again, this is just an example of muscle mass, asking questions about muscle mass, because it is a very important marker that we look at. And then other lifestyle behaviors. We are working with you during this process. It's really not about us just pushing information down your throat. We take a very interactive approach. And when we're goal setting with you, we are actually we're asking you what you can do. We want you to identify your needs. And so we can kind of keep moving you along the spectrum because everyone is different. We're definitely going to support you. We're going to provide insight, different ideas, different handouts. But this is really about you and your journey and you thinking through a lot of these, different aspects of your health. So what to expect at your visits. So prior to coming in, we are going to have you fill out some paperwork. You'll fill out our medical intake form. And then your first visit will be about 45 minutes. And what that looks like is you will meet with our practitioner and they're going to review your medical history, consents, contraindications. We don't require blood work prior to starting semaglutide, but if you have blood work, we will ask you to bring it in. It's very helpful to have that information. But again, we don't require it because there isn't anything on the blood work, on the labs, the general labs that we would do that would be a contraindication for you starting the program. So just keep that in mind because people do ask that question. You'll receive a physical assessment. Again, we're going to do a comprehensive in-body. We're going to review the results with you, making sure you understand as you go through this process, what are you losing? Because you're going to lose weight. We just have to make sure it's the right stuff. We're going to teach you the subcutaneous injection. You're going to take your first injection in the clinic. And then at that visit, we will give you one additional injection for you to self-inject in 1 week. After you have your physical assessment, you will meet with either a nutritionist or dietitian, and they're going to review your goals with you, get you set up on our app because our app is going to provide you with different recipes. It's going to take you day by day and teach you about the medication, all different things that you would want to know as you're going through this program. You also have the ability to log your food and message through our app. We're going to provide you with the meal plan. And like I mentioned, logging food is very, very important. And we're also going to assess if there's any supplement needs. We are advocates of supplements. We just want to make sure that we are customizing and strategizing with each individual. There are protocols that we develop because there are just essential nutrients that everyone needs. And we do have a couple protocols such as the semaglutide supplement protocol, which does include our basic essentials, which essentially are a probiotic, fish oil, vitamin D, K2, and magnesium. Those are kind of the essentials basically everyone should be on those products. And then we'll also talk about different protein supplement options as well. Your second visit will be week 3, because again, these are bi-weekly visits, and you will meet with our nutritionist or other practitioner. And again, we're going to weigh you. We are going to review the diet. We're going to address any other needs that you have. We're also going to review your semaglutide pre-appointment assessment form, the one that we reviewed just a couple slides back. And we're going to cater that appointment basically based on your needs. We'll make suggestions, modifications to diet. If there's a certain topic that you're interested in, we have many different handouts that can help support, if you're experiencing hunger, if you're plateauing, what type of exercise should you be doing? Are you sleeping at night? That type of thing. So we're kind of prepared to address all different lifestyle things as well. Like I said, we are big in supplements, and we will be kind of, assessing, is there a need for certain supplements along the way. And then at that visit, we are going to dispense 2 injections for you to take once a week. After your month, you'll come in at the end of the month for a monthly visit, and that is 30-minute visit. And at that visit, you will have the full body composition assessment. So we want to make sure, I know this is kind of small, but we want to make sure that we are looking at not only your weight, but we're looking at your muscle mass, we're looking at your visceral fat, again, different components to the total weight loss. We're going to set 1 to 2 goals at every visit, and these are going to be goals that we work with you on because it's very important to us that we're moving you along the spectrum. So many people will ask, how long should you stay on semaglutide? Well, semaglutide is a medication that's approved for long-term use. So for our patients, most people will stay on it until they achieve their weight loss goals, or they feel like they're ready to transition. They feel like, they've learned a lot. They understand what they should be, eating and how they should be incorporating certain behaviors. So it really just depends on the person. Some people actually will decide to go down on a low dose, so that they can still gain the benefits of some of, the appetite suppression, the fat burning, and stay on a lower dose for a longer period of time. Your metabolic health will really dictate your weight gain vulnerabilities afterwards. We'll talk a little bit more about that. And our patients stay on semaglutide for an average of 6 months to a year or more. So just a little bit about semaglutide dosing. Semaglutide is a titratable medication. The titrations and dosage really depends on the vial size and concentration. It depends on where you're getting the product. So the reason why I mention this is because some people will order semaglutide from a different company and they're looking at their dosing and they think it's the same because they were given a different dose somewhere else. Just please note that all semaglutide is not all the same. They're different concentrations. They might be a different vial size. So you can't really compare apples to apples. It just varies significantly. What I will say is most patients do pretty well at like the mid-range dose on semaglutide because the higher the dose, the more effective for weight loss, but also the more side effects. So you do have to kind of balance that out and, assess with the patient kind of where they should be. Side effects are usually at the beginning. They're usually transient. We usually can work with the patients for a couple weeks, and then usually that will go away. If the gut issues persist, it's usually a sign that there's something more going on, pre-existing gut issues. And so we're kind of pivoting a little bit and working with the patient on the gut before they would, progress with the weight loss. So more on dosing management, and just again, this is for your own information. And if you decide to work with us, this is kind of how we're assessing, dosing in certain situations. But if you are losing weight and you have minimal symptoms, we're going to keep you at the most effective dose. So we know that there's a protocol out there, but we have found that we have tweaked things over the years just to best benefit the patient. If a patient comes to us and they have increased symptoms, then we're typically going to lower the dose to the last tolerated dose. We want patients to know that if they are at higher doses, there may be an increase in price. We are always monitoring when we're titrating the dose, because again, when we're increasing the dose, there is that potential for increase in side effects. If a patient doesn't lose weight after 3 months, which is very, very rare, I don't think we have ever seen that, but there are some patients that really don't lose as much for whatever reason. Usually it's their priorities are somewhere else. But if they're not losing, then we're going to consider stopping the treatment, maybe trying something different. It really depends on, why the weight loss is slow. And again, some patients will go down to a much lower dose to continue more a maintenance plan. And again, just going back to every patient is very different and everyone will have kind of their sweet spot dose. So as a reminder, you will be coming in for bi-weekly visits. So every 2 weeks, you will come in, you will receive 2 injections at each visit. You pay for the month. So you pay for the, obviously you receive the follow-ups. Injections are once a week. Injections must be kept cold and away from light. Semaglutide should not stay in the fridge for longer than 4 weeks in the syringes. And we will provide vials for patients who would rather come in monthly. So if you are a patient of ours and you're experiencing hunger at the beginning, it's typically due to the dose because it is a titratable dose. So it may be because the dose is too low. It may also be due to the diet. We're always, working with people on their diet. We're providing certain meal plans and recipes, but we definitely help our patients understand that the more they eat, processed carbs, a lot of sugar, desserts, it's going to be less effective. I mean, it's just the nature of how the medication works. Exercise and movement is very important. We always are, kind of bringing this in if the patient is ready to focus on that. And what we have seen is following our meal plan guidelines absolutely leads to more success and really makes it worth the investment to our patients. At your biweekly visit, you'll receive an automated assessment, and this really allows us to plan for your visit. So we do expect you to fill it out. It is automated. You just click certain things. It's very easy to fill out, but it really allows you to also identify your areas of needed support and work on certain things each week. Our goal is to coach and to support you along the way. We strive to move you along the spectrum so that you are prepared for more of that maintenance phase. Eventually, you will go off of semaglutide. So our goal is to get you prepared for that phase after the medication. Small changes go a long way. And again, at Weighless MD, we focus on more than just the food because, there are different components that come into play. So will this work for you? Most patients have metabolic dysfunction. The studies show that 90% of people have metabolic dysfunction. So most people do really well. Now, if you are somebody who has underlying gut issues, then we will recommend our GI map test, or we will recommend doing our total gut reset program first to kind of get some rebalancing, get some healing going on before going on the medication. If you're someone who struggles with emotional and psychological issues with food and still are experiencing like cravings and hunger, and it's not necessarily the physical part of the medication, it's more of emotional, then we are going to have to dig deeper into that. We don't want to see you continuously struggle when we've kind of ignored an important piece. Obesity is multifactorial. I say it all the time. There are other components, but we have become so good at kind of like pulling all of those main pieces together. So whether it's the gut health, hormones, food sensitivities, toxicities, inflammation in the body, etc. We're really good at assessing and identifying, certain things that the patient can do to move them along. What type of diet while on semaglutide? We start people on a more balanced, lower carb diet. We do not require extreme calorie restriction by any means. We also talk about the frequency of your eating, not just what you're eating, because if you're somebody who eats small meals and snacks all day long, that is going to keep you in that kind of metabolic dysfunctional state because you're spiking the blood sugars all day long. So we really do talk to you about that. We ask people to eat 2 to 3 meals per day, try to limit snacks as much as possible. Intermittent fasting may be a great option for some people. And we are also ensuring that you're getting enough protein so that you maintain muscle mass and you enhance your fullness while on the program. Will you gain your weight back? Well, That's up to you. I mean, not necessarily, but it really does depend on your metabolic health. So if you are someone who had 100 pounds to lose, one on semaglutide, lost 40, and you still have 60 to lose, you're probably still metabolically inflexible. So that's going to dictate your vulnerabilities. Now, what also comes into play is what you lost through the process. You know, if you lost muscle and your fat was still kind of the same, but you just lost the weight, that's not putting you in a healthier state either. So we have to make sure we understand what you lost in the process, because by maintaining muscle and losing visceral fat, that is putting you in a healthier state. Do you still have blood sugar dysregulation? Do you still have chronic inflammation? Are you taking multiple other meds that are creating all of these different systems in the body to not, work naturally? Different things will come to play. So everyone is different, but this is what we're working with you at your, kind of when you decide to transition off of the medication. Here are just some signs that you still have metabolic dysfunction. If you still have cravings after eating a meal, if you have sugar cravings that aren't relieved by eating sweets, or if you're tired after meals, you have brain fog, trouble concentrating, visual problems, went into your doctor and your fasting blood sugars are still above 90, or if you are taking medication for cholesterol, blood pressure, any of the other lifestyle medications, that's metabolic dysfunction. Even if your levels are within normal range, it's still metabolic dysfunction because meds just make the test look good. It's not really doing anything to heal your body. And we do have different options to assess your metabolic health, such as our metabolic health quiz, and then we have a metabolic health blood panel. Is semaglutide safe? So this is a very common concern for a lot of people when they start on this medication, because they're injecting this medication. And it is a medication, again, every medication on the planet has some side effects. And I own the business. Whenever I bring in any type of program, service, medication, I am doing my due diligence. I want to make sure that this is going to be safe, not only for my patients, but for my family members, because I know that my family, friends, they are going to be lined up and they're going to want to go on the newest and greatest, weight loss programs. So what we do know is that the GPL, so the glucagon-like peptides class of drugs, have been around for over 10 years. So we can feel comfortable knowing that they have been around for longer than we know because of the class of drug. Now, what we know for safety or side effects is that there are side effects related to the gut. Gastroparesis, there was a study done, 1% of Ozempic patients had or developed gastroparesis. So this is that slowing of the gut motility. There has been studies showing people are developing SIBO, which is small intestinal bacteria overgrowth. Again, it's due to the slowing down the motility of the gut. It's supposed to help you with fullness, but the side effect is that it could cause, these other things happening. Some reported suicidal thoughts. We know that it can have an effect on the pancreas, because it works on the pancreas to actually produce more insulin. So if you have an inflamed pancreas and you go on this and now you develop pancreatitis, it's probably because you had prior issues without knowing it. Bowel obstruction has been noted, and ileus has been noted, which is kind of like a bowel obstruction, and acute gallbladder disease. So these are things that people are experiencing from a safety perspective. It seems to be relatively low, but again, these are possible side effects or conditions, and that's why we are doing our due diligence throughout the program and when you start. The nice thing is there actually are studies showing that it is improving many different things. Studies are showing a decreased risk of cardiovascular events because, again, you're improving this blood sugar regulation. That affects everything: blood flow to the heart, microcirculation, macrocirculation. I mean, it affects so many areas in the body. Obviously, it's improving glucose regulation. Studies are showing it's neuroprotective, meaning brain protective. It's helping people with long-term weight loss and helping people with controlling their hunger and appetite. So those are all positive effects of the medication. How do you keep it off? Well, hopefully you know that things come with change. There's no miracle. And you don't go on semaglutide and lose 30 pounds and then think it's all going to stay if you haven't made some changes afterwards. So again, this is not about being perfect after, but we have to have relatively some good habits. We provide many different options for people after a program. Are different supplements that we recommend that actually can mimic semaglutide and help improve muscle mass, such as our blood sugar balance, our cortisol balance, DHEA are 3 most popular that we use after semaglutide. But we're providing healthy eating plans for sustainable weight loss. Some people will stay on low dose semaglutide. Some people want to continue to come in monthly just for a body composition test. And again, we're looking at exercise. We're looking at other lifestyle changes that people are really willing to commit long term. And the diet that we recommend really depends on their metabolic health. So we'll be able to determine where they are metabolically by the assessments and the testing we do afterwards. And I'm just going to wrap up here with some of our results. We have hundreds, I think thousands of patients who have been on semaglutide by now, but we did pull some numbers. And what we looked at was how patients did up to 12 weeks on semaglutide. And what we found was that they lost an average of 18 pounds. There was about a 2.4 pound loss of muscle mass, and the visceral fat change went down 2 points, which visceral fat on our body composition scale is measured in centimeters squared. So that was, those are the results for 12 weeks. And then we looked at 21 patients that stayed on semaglutide for up to 24 weeks. And we saw an average weight loss of about 31 pounds. So that was an average of 1 pound per week. We did see it go from 1.5 pounds to 1 pound after the 12 weeks. So it started to taper a little bit, but patients still were losing weight. The muscle mass was a little bit more just because they were losing more weight. It's normal to lose some muscle, but again, we are making sure that they're doing the right things to bring that muscle back up as they go into maintenance. And in the 24 weeks, the visceral fat went down 5 points, which was pretty significant. And here's just some of our, patient examples. This is an 8-week semaglutide patient. You could see body fat, 32 pounds, went down to 24 pounds in 8 weeks. Her muscle mass stayed the same, so that was great. This particular patient did 12 weeks of semaglutide, started at 275, ended at 224, just had great results. Visceral fat went from 20, a very unhealthy 20, to almost a healthy 12. Body fat, you can see almost 40 pounds of just body fat loss. So that was really great. A 3-month semaglutide patient, visceral fat went from 10 to 7. Body fat, she went from 50.7 to 38 pounds of just body fat. So these are all significant results. There is one that had really great results. You can just see she looks like a different person. She was on semaglutide for 6 months and just changed so many different things throughout the 6 months. But visceral fat went from 16 to a healthy 10. She lost over 20 pounds of just body fat. So 73 pounds of her total weight was fat. And when she ended, it was 48. So that is it. Hopefully that was helpful. If you are interested in scheduling a consult, you can give us a call or click on the link. Thank you so much.